Hello, everybody. Good afternoon. It's good to be with you again. Welcome to Doctors Go Live on Columbia Asia Facebook. So today we have a very interesting topic. I think a lot of people are interested in this particular subject. This is about skin diseases. And today we're going to be talking about the top 10 skin diseases. And we have with us, all the way from Columbia Asia Hospital, Iskandar Puteri. Okay. She is a specialist in skin diseases and anything to do with dermatology. Okay. And of course, this is consultant dermatologist, Dr. Latha R. Selvarajah. Okay, Dr. Latha, hello. How are you this afternoon?
Hi, Sakina. Thanks for the introduction. I'm good today. And to all who are listening, thank you for logging in into our Facebook Live today. We hope that we will have a very good session, and I'm going to have to try to share with you as much as I can about what I think is the commonest skin problems and the commonest things that I see in my clinic. All right, so I
Yeah.
really hope that you benefit.
Yes. Well, it's about it's very depressing actually for some people, and it's very embarrassing because if we're talking about skin problems, this is something that other people can see. So it might cause stigma, it might cause depression. This is not something that is out of reach because it does happen. So let's take a look at the 10 most common skin diseases, and we will start with number one. Okay, before we go into the details, let's have Dr. Latha explain about facts regarding the human skin. Take it away, Dr.
Uh,
Latha.
okay, all right. So, before I go on, let me just say that today's session is about the commonest skin problems that I usually encounter. All right, I'm going to share with you all how to recognize them, what are the treatment available, so that you won't feel like depressed sitting there and thinking, oh, there's nothing that you can do about your skin. Actually, there's a lot
Correct.
of things that we can do. There's a lot of treatment available, and what you can do on your part to try to prevent some of these. So let's just start off with some amazing facts about the skin. All right. For those who haven't known it yet, skin is actually the largest organ in our body. Yes, it's actually even bigger than the intestine, all that. It's the largest. Okay. That is why a lot of problems can arise from it. You can see here on my slide, it's about like 20 square feet. It weighs about 9 pounds, which is like close to about 4 kg. All right. And it's a lot of structures in it, and the main thing is actually the blood vessels. So any part of these structures can be affected in any of the skin problems, and that is how we actually address each and every one of it. So we
Okay.
shall move on to the
Okay.
first
All
one.
right. Yeah. Let's start with the first skin ailment in today's topic. It's acne. Okay, this is very, very common. So I think some people don't even realize that this falls under skin disease. It's that common. So maybe you want to explain a little bit about
Yes.
acne, what causes acne, and yeah, the reasons behind acne. Acne.
Okay, all right. So one of the most nightmare, especially for teenagers, is that when you get up and you
Yeah,
see that zit on your face, like, oh my
yeah,
God, it's my most important day, and that's it. I'm having this, or on your like wedding day or something. You truly don't
mm,
want a truly nice face, clear face, and this is something you really don't want to have. I don't have to talk
yeah,
so much about how you're going to recognize acne. I think
yes,
most of us will not be as lucky that we have never encountered acne in our life. I'm sure at least one or two, or if you're that really lucky person who never had acne at your teenage life, maybe don't be too happy, because it can still come on at like 30s or 40s, especially for ladies. So what is actually causing this acne? Okay, the major driving factor that causes acne is actually the blockage of the oil glands. Okay, there's a lot of oil glands, especially around the face, the trunk,
yeah,
on the back. Okay, and when these oil glands get blocked, they produce a lot of sebum actually, and when they get blocked, and they get blocked together with all the dead skin cells, and this is how the acne actually form. And this is what you see as the whiteheads and the blackheads. And whenever there's another infection that comes in, usually there's a lot of bacteria that grows on it, and this is when you start seeing all this unsightly, red colored dots, papules, all this like pus, or even some people may have very bad acne like this cysts and all that. So what can cause this overproduction of sebum? Most of the time, they're actually hormonal imbalance. Okay, when the person actually reaches puberty, there'll be a bit of hormonal imbalance, usually a bit of predominant of the male hormone, and this is where the sebum production actually comes in excessive, and this will actually give rise to acne. And there's a small point that I want to put up here for ladies, especially, even in
Yeah.
the younger age group, that whenever you have, you have a lot of acne, and you also see that your menses are actually irregular, and you start having a lot of this unwanted facial and body hair, there's a condition that you have to think about, which is actually polycystic ovarian syndrome, where it can actually give rise to this uh, bad acne together with these irregular periods, and you also see that you are actually gaining a lot of weight. If you have that kind of symptoms, please go and seek help. You can see either your gynecologist, or you can even come and see a dermatologist. Actually, we can get all these things sorted out, and you do not have to suffer in silence. All right. And other than
Yeah.
hormonal, of course, acne is also partly genetic. So usually, if you have close family members with very bad acne, you have a higher tendency to actually develop acne. At the same time, other trigger factors for acne is definitely stress. So, exam times, times that you have got this important date or something when you're stressed, that it is actually a trigger for the acne to come up. Another important thing is that, the cosmeceuticals that you use every day, if you use the wrong products that can
Yeah.
actually block the oil glands, that is going to actually cause acne to come up. And another thing that people don't usually note is that certain types of medications can actually give rise to acne. A lot of people nowadays, they're actually quite concerned about their body build and all that. These are common things that I see in my clinic. They go and get supplements. Sometimes we don't really know what's in the supplements. And if, say, it's a bad luck, you come across the product which is not right, and they may have added some steroids in it, and these can actually cause acne. Okay, any use of steroids and all that, it can actually predispose to acne, and it can be a very bad acne. So we need to identify all these factors, right? Okay.
Mhm. Okay. And what happens when we have acne? What will be your recommendations?
Okay, all right. Do not, number one, do not despair. Acne is something that we can really help you, especially we dermatologists. Okay. If you have one or two acne, few zits on your face, okay, then maybe it's not justified to straight away run to your dermatologist and cry to us. No, not necessary. You can actually go to the pharmacies. You can actually, please go to the pharmacies, not like any, unlicensed, don't use
Yeah.
some unlicensed product from the pasar malam or anything. Please avoid from that. Okay, go to a pharmacies, a recognized pharmacies. There they can actually advise you on the topical, that means the creams that you can actually apply. Usually we will give like creams like benzoyl peroxide. Okay, this
Yeah.
is actually antibacterial cream. Is also anti-inflammatory. At the same time, the other cream that we usually recommend is actually retinoid cream or topical vitamin A creams. These all can actually help with acne. And if it doesn't get better, there's even more, then please do come and see your dermatologist, okay? Because we've got very good treatment nowadays for acne, including oral medications, okay?
Oh.
And the safety of these oral medications it's already established. We would know how to actually monitor. Definitely, we will tell you what are all the side effects, so that
Yeah.
you will be comfortable when you take it, and you know how to take it, what to watch out for. And if you do it regularly, uh, especially with the newer medications such as the oral retinoids, you can actually have almost clear skin. And in fact, after you finish the whole course of this acne treatment, when we stop the treatment, most of the time your face will actually stay clear. So there's actually a lot of breakthrough, good treatment for acne. Please don't shy away. Please come forward and seek help, because the earlier you seek help, the better the control is going to be. And
Yeah.
without by stopping the acne from coming up, you can actually reduce chances of scarring, because once you have the acne scars or the acne pigmentation, that will be even harder to actually treat, right?
Yeah.
So please
Yeah.
come early.
Right. Okay. How can we prevent acne? Maybe you can share some tips.
Okay, all right. This part is actually quite important. Other than coming to seek early treatment, which you should, if you try all the creams, it doesn't work, please do come and seek treatment. At the same time, on your side, what you can do is try to control your temptation to squeeze that acne. Okay, all right. By squeezing it, it's really going to do more harm than good. Number one, it's going to spread the infection, and number two, is going to
Yeah.
leave a very unsightly scar, and you don't want that to happen. All right. Treating scars are not easy, and they are very expensive, because most of the time you need to actually resort to laser treatment. Okay, and then as I mentioned earlier, one of the causes of acne, one of the triggers is actually using the wrong cosmeceuticals. So
Yeah.
please, whenever you choose your products, if possible, if you don't have to use makeup, do not use it. If you need to use makeup or certain creams, please look for creams that's non-comedogenic. That means it doesn't block the pores. All right,
Yeah.
and what it is, once you put on the makeup, you come back, quickly wash it off and keep your face clean.
Right.
All right. Previously, people used to debate a lot whether diet plays an important role in acne or not. And after many research, we found that actually diet does play, although it's a small role, but it does play a role in causing acne, especially
Yeah.
diet which is high in sugars and all that. These actually can stimulate the sebaceous gland to actually be more active and cause the sebum production and a blockage and lead to acne. So try in that aspect. You must have a healthy diet, low sugar diet, okay, and then probably try to avoid dairy products, which is also have been seen to actually cause acne, right?
Mm.
Okay.
Yeah.
And regularly
Um,
clean your face. Do not use scrubs. Use gentle
yeah.
cleansers. That should do for your face.
See. So scrubs are not recommended if you have acne.
Nope, nope. You must be gentle, because the scrub itself
Yes.
can irritate the skin, and then after
Yeah
it
lah.
can
Yeah
actually
lah.
give rise to acne.
Yeah. Yeah. Of course. Talking about the dietary sharing just now, what about chocolates and peanuts? Because I think there's also I've heard before that chocolates and
Yes.
peanuts can cause acne. So
Okay.
some
Yes.
teenagers, you're clear from that.
It has found that it can contribute towards acne. All right, not for
Oh.
everyone, and may not
Mm.
be one of the most important cause. But yes,
Mm.
if you think whenever you take chocolates, you take peanuts, it does aggravate
Right.
your acne. Please try to
I
avoid it.
see. Understand. Okay, so it's somewhat true. Okay, now let's move on from acne. But if you've got any questions, ladies and gentlemen, you can always type in your questions in the comment section. And at the end of the talk, we will address those questions live. Okay, now we are going to be talking about eczema. Okay, this is also a very common skin disease. Okay, what exactly is eczema and what causes eczema?
Okay, eczema is a very broad term, as you put it. There are many, many types of eczema, but the most common one we see is the one that, in children, when they come up at the age about a few
Mm.
months old itself,
Yeah,
you see the red spots on the face, and then they start
right,
affecting over the neck and also over
right.
the skin folds and all that. And they're very, very, very itchy. It is so difficult not to stretch the eczema. If
Yeah,
it's not itchy, it's less likely to be eczema.
I
Right?
see.
Okay, so it's quite typical, these red
Right.
patches, scaly and very
Yeah.
itchy patches, and usually
So
it'll come on.
itchiness is definitely an indication that it is eczema.
Sorry, Sakina?
Itchiness is an indication that it is
Yes.
eczema.
I mean,
Okay.
okay, it's not everything that itches is eczema,
Oh
of
yeah, yeah.
course, but if you want to call it eczema,
Mm.
99% of the time it must be itchy unless it's a well-treated
Right.
eczema, right?
Oh,
Okay,
okay, okay.
so
All right.
okay, and it's really very, very common problem. It's one of those main things on a day in a
Mm.
normal dermatology
Mm.
clinic. If you don't see eczema, it's like
Yeah.
there is no sunshine kind of thing. So it's very common. Okay, it's very common, and there's a lot of factors that can actually cause eczema. People used
Mm.
to come and ask me, doctor, the main thing that will come in is that, doctor, I ate this and that's why my eczema got. Doctor, I ate that. Okay, just now when I talked about
Mm.
diet,
Yeah.
and I said that, it can play a role for acne, but in
Yeah.
eczema, All right, diet is a very, very uncommon trigger. There are much, much more important things that it can actually trigger off eczema. All
Mm.
right, why a certain people gets eczema and certain people don't have it? A
Yes.
lot of things. Eczema is mainly genetic, meaning that genetic is an atopic disease. Let's just say you
Mm.
have a family member who either have eczema or bronchial
Yeah.
asthma, or allergic
Yeah.
rhinitis. The rest don't.
Mm. Mm.
So the
Mm.
chances are that the person can actually have eczema or any other of the other atopic diseases such as the bronchial asthma or the
Yeah.
allergic rhinitis. Okay,
Right.
and
Mm.
having said that, once the eczema is there, we sort of have to control. But there's certain things that sometimes the eczema can stay quiet. They do not come out
Mm.
suddenly. Then there is like a flare. It becomes so red, so itchy, and these are all the we would say the trigger factors for eczema. And one of the most common trigger factor is actually sweat. Because what sweat does is actually it alters the skin pH. When you alter the skin pH, it's going to affect the skin barrier. As in eczema, the skin barrier is already defective. So, easily any external infection and all that can set in and trigger off the eczema. Another thing is, yes, infections. Infections itself, when it comes on, it can actually cause the eczema to get worse. Another thing is chemical irritants, be it from your clothes, from your washing hand soap, from your washing your dishwashers and whatever things that you use, chemicals, it can actually sort of like trigger off the eczema because it irritates the skin. Okay, so these are among the most common trigger for eczema, and yes, they are much, much more common than your squid, than your prawn, than your any seafood, than your ayam jantan or ayam betina. Honestly, no different species of chicken or no different species of squid or prawn that can actually trigger your eczema is honestly the sweat and also the infection. All right, so that
Yeah.
brings
Yeah.
eczema.
Yeah. I've seen some people with eczema. It's very distressing. Actually. I mean, what more for the person who's suffering from it, especially
Yes,
children, because you can't tell them not
yes,
to itch. They'll be scratch, not
yes,
to itch, but not to
correct.
scratch,
They
and they'll be
cannot.
scratching all the time.
Correct. Very difficult to
Mm.
tell them not
Yeah.
to stretch. So what you can do, how kind you can be to them is that is the next slide I'm going to come about how we can actually treat eczema. All right, the main thing you can do for your children or even for yourself with eczema is that you must moisturize the skin. Please remember, in the treatment of eczema, there is no one miracle drug, there is no one miracle cream. It is a very disciplined approach where you must actually constantly care for the skin, either if you are the affected person or even worse if the children are affected. It is actually very, very, it's a time consuming thing to do whenever you have eczema, because you must regularly moisturize the skin. And this is the part. Okay, when you moisturize the skin, the chances of eczema coming is actually very less. But then, like I said earlier, there are triggers. Whenever the child is stressed, whenever he's sweating, or if there is infection set in, that is when the eczema flare. And you see on the picture here, it become this very reddish patches, and then these are like the scratch marks where it's actually very itchy and they scratch off. So this is called like the flare of eczema. It's like your skin is on fire, put it that way. And when the fire is on, if you take it in a layman term, like the house is burning, the fire is there, you need to put out the fire. Okay, there's no more, the maintenance is there, but to put out the fire, we need to use the steroid creams. A lot of people come to me, doctor, steroid, no, please no. But they can go out to the pasar malam and then they get any of the creams there, and they do not question much, because here in most clinics, most of us doctors, we will actually explain in detail what we are giving. So that is why you feel a bit alarmed. But please be assured, especially in the hands of good dermatologists, good doctors, we will know what are the correct steroids to give, what steroids that can be used in which areas, because there's a lot of strength of steroids, different strength that and the proper ones that you can use and how long you can use for each of the places. Because if you do not do that, the fire can never be put out and it will start spreading. So you have to do that. And if, let's just say, you really, really steroid phobic parents and all that, then I would actually go on and say, okay, we've got options of non-steroid creams. They are quite as effective as steroid creams, but they're a bit slower in action. They feel they have a little bit of burning sensation, and they're also not only burning sensation on the skin, probably burning sensation on the pocket, because they're actually quite expensive. All right. So once we can actually put down this fire, then we can slowly cut off the steroid and go back to actually just the moisturizer alone. But unfortunately, not everyone fortunate enough to actually have a mild eczema where you can just control with just the creams. Sometimes they have very bad eczema, almost the whole body is affected. It's not feasible to actually put on the creams, and that's when we have new treatments where we have phototherapy treatment available in many hospitals, oral treatment for eczema, and now there are more and more breakthroughs. We even have injections for eczema, and bear in mind, these are not steroid injections. They're actually injections targeted at all the inflammation that actually causes the eczema, and they have shown to be very safe and effective for eczema. So please don't be despaired. Please don't be devastated that you have eczema. There's a lot of things that can be done to help you. You just need to come and seek treatment. All right. Okay.
Yeah.
But always remember,
Mm.
don't be too like, I come to see the doctor and I want one-time treatment and everything goes off. No, eczema is like up and down kind of thing. Infection, stress, sweating, and all that, it will trigger it off. So whatever treatment you give will definitely help you to control the eczema, but we cannot actually cure. But the good thing is, when eczema starts young, usually as you grow older, it gets less and less severe for majority of the children. So that is the good side of it.
I see, I see. So there is no way for eczema to be cured permanently, lah. I mean, you just have to live and manage it. Is that right?
Actually, they will get better. You become less and less severe. But then usually what I tell my patients, that although they do not have it anymore, please do not stop the moisturizing. Moisturizing is actually very, very important to prevent the next flare of eczema. Always keep your skin moisturized.
Okay, okay. How can we prevent eczema from happening?
Okay, all right. So eczema is genetic, right? So if you are going to get it, you will get it, but to reduce the chances of it, you can regularly moisturize. In fact, certain studies, but they are actually still mixed results for it. Whenever you have a tendency in the family that there is a family history of eczema or allergic rhinitis or asthma, we would actually advise right from birth itself to regularly moisturize. And please remember, just now I also forgot to mention that when you are choosing a moisturizer, please choose a blend moisturizer, meaning that they contain the most minimum preservatives and they do not have any fragrances. If you go and use the ones with the fragrance moisturizer and all that, it is like as if you're killing off your skin. So please remember, you must use the correct moisturizer, regularly moisturize. Okay, and even your bathing soap. Okay, another common myth in eczema is that, wow, I must keep my skin clean. I must clean it as clean as possible. I need to use the Dettol or the Entabase. That is really totally wrong, because these kind of harsh cleansers are actually very harmful, and they actually cause a lot of irritation to the skin, and they can actually cause flare up of eczema. So what we advocate are non-soap cleansers, meaning that soap cleansers means they actually bubble a lot. So all these non-soap cleansers, they do not bubble. They contain very minimal preservative, and they do not have any fragrances, and they actually moisturize the skin as they clean the skin. All right, so these are the ones that you should go for. All right, and then after you already know what are the triggers for eczema, like stress, infection, and all that. So if you have those triggers, please do seek treatment. If there's infection, seek treatment. If you're sweating and all that, I always tell my patients, please wipe off the sweat. If you're outside, if you're at home, quickly have like a quick bath, like mandi kerba also can. Okay, as long as you take off the sweat. All right, and here I would like to I would like to actually add on that we've got this website called Persatuan Eczema Malaysia. You can see here. All right, this is a website actually managed by dermatologists and pediatricians in there, and you would have all your good facts regarding eczema there. And currently, we are actually having a virtual charity run in this Persatuan Eczema, where you can, once you join the Persatuan, you can actually take part in this virtual charity run, because all these proceedings from this charity run will actually go towards helping our severe eczema cases. Right?
Yeah.
Okay, so you can get even more information from this Facebook page of Persatuan Eczema Malaysia. I encourage all of you to actually join it, because you can get actually more information from that.
Right, I see. So that sounds like a good support system. Okay, next we're going to take a look at fungal infection. The question that comes with this is, how does one actually get fungal infection? And maybe we take a look at what it looks like.
Okay, all right. So here you can see, typically, usual, sometimes people will call it ringworm, because you see it's like not a diamond ring at all, obviously not. It's just a red patch there with this darker red ring, okay? And usually they like to come on skin folds, because this fungus pulat, they like to grow on all these tan places. So they will grow carefully there, as long as you don't dry that place and all that, they will come up. And then here, if you can see closely, you can see these whitish patches. This is what we call as panau in Malay, pityriasis versicolor in English. So this is another type of fungal infection also. Frequently, you see it over the area on the face, on the trunk, and usually on the upper arms. And sometimes, especially in diabetic patient, if you open up their toes, in between the toe web spaces, you can see these whitish patches. These are also fungal infection, and frequently we see these in those who wear closed-up shoes for a long time, especially those who need to wear, safety boots to work. They are actually quite prone to get this fungal infection in the feet.
Okay. That's, what are the treatments that come when you get fungal infections? What are the options?
Most of the time, we can get away with just creams, antifungal creams. Easily, you can get it in the pharmacy. All right, but sometimes this fungal infection can be quite extensive, so you may need oral fungal, and that is where the danger comes in, because some people usually like to go. They want to avoid seeing the doctor. They go and self-purchase antifungal. They get better, and they tend to continue with. Please be very wary that most of this antifungal has a side effect on the liver. So you really need to, if you're taking something of the antifungal of more than 1 week or 2 weeks, you already really should see the doctor, because you need to check on the livers. Do not take it like there's no end to it, because remember of the side effects. And another thing about these fungal infections is that if it's on the body and all that, usually with the creams, if it's not so bad, we can actually control with creams. But sometimes you get this fungal infection on the scalp, as you can see here, especially among children, this scaly patch on the scalp. And sometimes this fungal infection can also affect on the males. So these kind of infections, we usually need to start oral antifungal, and this is the time you should come and see your dermatologist, because we will actually scrape to see what kind of fungus is that, so that we can give you the right treatment. And the treatment duration is actually quite long, nothing less than 6 weeks. That's why you need to see us to actually get proper assessment, and then proper treatment and monitoring during the treatment is very important. Please don't take this kind of matters into your hands. Right?
Is it itchy? Fungal infection?
It can be itchy. It may not be itchy. Fungus, it may or may not be itchy. Unlike eczema, eczema is really very itchy.
Yeah. Okay. How can we prevent fungal infection from happening?
Okay, basically, because it loves moist places, so always, especially at the skin fold areas, all that, try to keep it dry. Wash off, dry it off. Okay. And once you have fungal infection, try to avoid sharing of your personal items, because it can actually spread to other family members.
Okay, there you go. That was fungal infection. Now let's move on to the next skin disease. This is about hives. Okay, doctor, can you elaborate about what hives look like? I mean, we can see it on the screen, but perhaps what are they actually like? How they feel? What's the texture of hives, and its possible causes?
Okay, all right. If I say just now eczema is very itchy, this is like 100 times itchier. Okay, it's really very itchy. So it's actually, in fact, a very common problem. People come and they say that, oh my God, I had this rash and this really red big one, like something bit me and then it went off. Now it's coming to another place, it's coming to another place, and sometimes the worst case is that when it causes a lot of swelling around the eyes or lips,
Oh,
that is called angioedema. That's even worse. So this is what hives is. Hives is like even I've seen so many cases in my clinic that I even know what it's called in Chinese. They usually call it as fomok. Okay, in Malay you call it the gutter. Okay, so this
yes, yes.
just come on suddenly on the body. It's
Yeah.
very itchy. These red spots is as if like something bit you. It will go off within a few hours and then it'll come back again and it'll come back again. So that's typical hives. Sometimes some people when they scratch on the skin also they can see that red mark there. That is also a kind of hive. All right.
Yeah.
So if it suddenly comes on, you've been well all this time, and suddenly you see these hives coming up, usually there's a bit of trigger for that. For children,
Yeah.
whenever they start coming up with hives, usually we'll look for causes like, maybe they got some viral infection that triggered out these hives. Or maybe sometimes it's like for certain people, if you think there is a food trigger for it, then you can associate it with the food. Like in certain populations, sometimes they are like totally allergic to gluten or to nuts. If they take only, suddenly they have a lot of hives, and sometimes they can even have difficulty in breathing because they can have this swelling over the airways. So this is the danger part of the hives. If you look at infection drugs, if it's not there, food is not there, then the other thing is certain type of medications. If you're allergic to it, allergic manifestation also comes out as hive. So it will be very, very, very itchy. But most of the time, when you take off this trigger factor, it will actually resolve. But we in my dermatology clinic, other than this, sudden onset of hive, which after you take off the trigger factor, they get better. Sometimes they have this hive that keep on coming and coming, whatever. Even you take off, you think it was the food, you try to avoid it, it still comes back, and it goes on and on beyond 3 months. That's when we say this is actually a chronic chronic urticaria. This is when you actually need to come and see the dermatologist, because we need to assess is there any other possible cause for it, and we need to control the symptoms, because honestly it is a very, we would say, troubling skin condition to have. It's so itchy, they can't even do their work, they keep on scratching and scratching and scratching. It's very distressing for the patient. Some of them can't even sleep the whole night because of these hives. So if you do have that, people who have that, please come and seek treatment, because there are a lot of available treatments for this. Okay.
Yeah. Would you say that this is the itchiest skin disease? You were saying that it could be 100 times worse than eczema.
It's one of the itchiest. Okay.
One of the
Heels, they are really very itchy. They're really very itchy.
yeah. What can we do about them? What's the treatment that you would recommend?
Most of the time, even for the one that's acute precipitated by infection or drugs and all that, we usually give antihistamines. If you have heard before, the cetirizine, loratadine, Piriton. These are the antihistamines that we usually use. Connection.
Maybe we want to move to the next one.
Okay, let me try and see whether I can go to the next one.
Okay, please bear with us for a few seconds, ladies and gentlemen.
Okay,
Just gonna sort out this hives. Excuse me. Hives. Oh yeah, we are talking about hives here.
Yeah, the hives. All right. Maybe while we're trying to set up the slides,
yeah, we can carry on.
Yeah, we can carry on.
We were talking about treatments just now. It's something that you can elaborate.
Yes, correct. If let's just say the initial part for whatever type, whether it's acute meals or is it over the months they've been having it, things that usually start is actually antihistamines as the first line that you start, and then if let's just say it doesn't get better with these antihistamines, then we will actually move on to nowadays we've got good breakthrough medications, what we call as anti-IgE injections that can be given, especially for the chronic urticaria. Okay, and sometimes when these hives get very bad, they're actually very extensive. We would actually prescribe a short course of steroids to actually try to make the hives get better faster. And these steroids, especially if they're having any, swelling around the eyes, around the mouth, this is when we will actually give a short course of steroids. Steroids is not something long term we're going to use for hives. It's just to actually make the these symptoms better, faster a little, and especially if they have any swelling.
Yeah. Can we prevent ourselves from getting hives from the beginning? Like if we really take care of ourselves, or what advice can you give so that we don't ever have hives? Like we don't start having hives.
Okay, okay. It's because hive, the trigger is like infections or insect bites. So of
Yeah.
course, things like that we can't really avoid. Can't avoid. But then if
Right.
you know that certain medication actually causes the hive, so make sure that you've got an allergy card for it. You avoid the trigger. Certain people, even the hives, you call it, these are like physical hives where when they do exercise, they sweat and these hives come up. So you know that you have this kind of exercise aggravated urticaria. So you will have to actually kind of if you do your exercise, try to wipe off the sweat quite fast so that you can actually try to prevent it from triggering off the extensive hive.
Yeah, I think that's very interesting because I think a lot of people are into sports and then they don't realize that sweat can actually be harmful to the skin. They would just let it dry on the skin. So maybe perhaps that's something that you would advise against.
Of course, I mean, you can go. I mean, when I talk about sweat and hives, it's
Mm.
actually for certain people. I mean, sweat is a trigger of the hive. Most people, they're quite all right, no issue at
Right.
all. Okay,
Mm.
but sweating itself, as what is the bad points about it is that if you have a skin like you're prone to eczema or fungal
Yeah.
infection, then yes, you
Yeah.
need to clean yourself, especially the eczema, wipe off the sweat. Fungal
Yeah.
infection, they love to grow where it's damp. So these are times where you really actually, if you sweat, wipe it off or go and clean itself.
I see. Okay. So don't let that risk happen lah. Yeah.
Yes,
Okay.
correct. You
So
try to
now,
prevent from coming up.
mm, okay, psoriasis. This is something very intriguing as well. What exactly is psoriasis?
All right. Why, very importantly, I put on this slide, although I know it's actually not very common as compared to eczema or hives and all
Mm.
that, but you do see people suffering from psoriasis, and this is a kind of a skin condition where it is so visible, and the red spots
Yeah.
or red patches
Yeah.
on the face, on the skin, it is so visible. It's very devastating for the patient, and
Mm.
a lot of them think that, oh my God, I cannot do anything about this. They
Yeah.
tend to turn to,
Mm.
unlicensed treatment, unsafe
Yeah.
treatment, and make the whole thing worse. So that is why I actually
Mm.
want to share this so that those who are listening, if you yourself think
Mm.
that you may have any symptoms that may
Mm.
suggest psoriasis, or you have
Yeah.
parents or family members, please come and seek early dermatology advice. Okay, psoriasis is actually characterized by these red patches, all right, that
Mm.
can usually occur on the scalp, on the
Yeah.
face, and then usually on these bony areas, the elbows, the knees, over the back. And when you look at it, you can actually draw a nice line around it. It's like the margin is actually very, very clear, and they're actually really, really very scaly. They may or may not be itchy. Okay, for psoriasis.
Oh, right. I see. I see. What are the symptoms and causes of psoriasis?
Okay, psoriasis is actually mainly genetic. Most of the time, you'll have a family history, somebody, uncle, aunt, parents, or
Oh,
sibling having
I see.
psoriasis. So the
Mm.
chances of the person having psoriasis, if it's in the family, will actually be
Mm.
higher. But having said
Mm.
that, if no one has psoriasis, it can still be something that is, sporadic. It can just come up.
Right.
There is also a bit of autoimmune
Mm.
thing behind psoriasis as well. Okay,
Okay.
and please, the most important message that I want you to know is that if this person has psoriasis, it is not contagious at all. You won't cannot be able to get psoriasis from touching a person with
Yeah.
another person with psoriasis. Please remember that. Okay, and psoriasis, they do not only affect on the skin, they can actually
Yeah.
affect on the on the nails, as you can see here. Okay, there will be discoloration, a lot of nail abnormalities that you can see, and they can even affect on the joints. And then if this part where the psoriasis patient starts having joint pains and do not seek treatment, within about 2 to 5 years, they'll already develop joint deformity. So it's very, very important to come and seek early treatment for psoriasis, and especially you've got psoriasis joint involvement.
Okay, can we talk about the treatment for psoriasis? What's available?
Okay. All right. In psoriasis, actually nowadays there's for mild psoriasis we use a lot of creams. Okay, and before that, psoriasis again, just like eczema, there is no cure for it, but we can actually control psoriasis.
Yeah.
Right. Okay, so there are creams that we can use for psoriasis, and for the bad psoriasis nowadays, they're actually very advanced treatment for psoriasis where they are called biologic injections. With these injections, they actually can sort of like clear or almost clear your psoriasis skin after treatment. And with maintenance of the treatment, you can maintain with a clear skin, and it can even help with the joints. What I want to really stress here is that help is there. Please come and see your dermatologist. There is very good treatment. Like I said, it's biologic treatment. It's really very effective. You just need to come and see us, get yourself assessed, and we will start the right treatment for you. Please, please, I put this in red. Please avoid traditional treatment. We've seen too many patients who
Highlighted and
go
bold.
out to get this medication and come in with very, very bad psoriasis. Just like eczema, we also have a support group for psoriasis, the Psoriasis Association of Johor. So those who have psoriasis, whenever you come and see us, you can actually join this persatuan. We've got a very active persatuan in Johor. Not many places has persatuan psoriasis. Only Johor, Penang, and KL has it. So we are one of those lucky people who actually have this support group. Please come forward, and we will help you in the way that we can.
Okay, all right. So that was about psoriasis. Okay, this next one, a lot of people don't realize that this problem actually falls under dermatology. It is alopecia, more commonly known as hair loss.
Okay,
So, Dr. Latha, please enlighten about the different types of alopecia.
Okay, all right. Before I go to hair loss, what I want to stress here is that some people with just a little bit, they comb the hair, a little bit of hair, they thought it's the end of the world for them. Please know that there is a normal hair loss in a day and what you consider as abnormal. So if you can see here, on a non-shampoo day, it is normal to lose up to 100 hair a day. And on a shampoo day, it is normal to lose 300 hair a day. Okay, this is like you have to just estimate. But if say, let's just say you're really losing a lot of hair, each time you comb your hair, there's like big chunks of hair coming out, and you see your scalp actually thinning, your hair is actually thinning, you can almost see the scalp. Yeah, that is bad. And unfortunately for men, this hair loss actually affects 75% of men, all right, and about a quarter of ladies. In fact, they say if you want to know a man's age, just look at the scalp, because about 30% of men at the age of 30 will already start balding.
Okay, can we talk about what we can do if
Okay, all right. So hair loss, there's actually a lot of different types. Okay, there is pattern hair loss. That means it's because of the hormonal. There's a male pattern hair loss, female pattern hair loss. We also have this hair loss where sometimes especially children, suddenly we know there is patches of hair. I mean patches of hair that is actually totally not there. So it's like patches. You can see patches of hair loss there, and this is called alopecia areata. It's actually an autoimmune condition. Always remember, there's also hair loss caused by harsh treatment to the hair. Whenever you do a lot of rebonding, coloring of the hair, tying the hair too tight, and all that, that also can cause alopecia. And of course, there is actually conditions where chemotherapy patients and all that, they are also prone to actually having hair loss. All right. So depending on what type of hair loss, what is the cause of it, we need to assess, and then we can administer the treatment. As for the alopecia areata, like I said, usually we see it in children, and suddenly you see these patches of areas where there's no hair. These are the ones that they respond very well to injections. Please do come and see us early so that we can actually treat And otherwise, if those who don't like injection and for the pattern hair loss, there are actually certain type of topical medications and sprays that you can use to actually help to stimulate hair growth. And sometimes, if it's very bad, we will start on certain oral medication. It really depends on what is the type of hair loss, is there any trigger factor, and what is the best treatment option. So all this must always be discussed, right? So there is no one right treatment for
Right.
it.
Of course, yeah. I guess
And
from what you're saying. Sorry, carry on.
I can say that it is not, honestly, it's not a very easy condition to treat, but nevertheless, please do come and seek treatment. We see what we can do and offer.
I see. Okay, we're gonna have to move faster, I think, Doctor, because we've got a few questions also to address.
Okay,
Okay,
all
let's
right.
go to our next type of skin
Right.
disease, warts.
All right. So warts is actually, in Malay you call it kutil, is this ugly looking growth that can come
Yeah.
on any part of the skin, all right, and it can even come on the private parts as well. Okay, please be informed. Yes, what's the causative factor is that human papilloma virus, as most of you, some of you may think that, oh, HPV, oh my god, HPV and cervical cancer, right? Okay, so remember HPV, it has the cancer type and the non-cancer type, all right. The non-cancer type, that's the one usually you see it on the skin, all right. And the one on the genital, they can be either the cancer type or the non-cancer type, all right. And this is how it actually look like. I don't have to explain. A picture paints
Yeah.
picture paints 1,000 words, right? Okay.
Yeah.
So these warts actually we can the natural history is that sometimes the warts on the hand, if you leave it alone, it can actually after a few months to a year, it can actually go off on its own. But a lot of times it's actually very difficult. Best to actually treat it because of it being very unsightly. It's ugly, and
Yeah.
the other thing is that when you stretch it, you go and touch another place, and if the skin is broken there, you could spread the wart, and you're going to spread it to another person. Best is to get it
Oh,
treated. So one
yeah.
of the better treatment is actually this cryotherapy, is actually liquid nitrogen. And I'm proud to say that in Columbia Asia Iskandar Puteri, we actually have this treatment available. Please do come, okay, and get your warts treated, okay. And if let's just say, for certain type of warts, especially the ones, the genital warts, we use topical acids. And let's just say all this doesn't work, the last option, we can actually excise them out.
Okay. All right. How about STDs, doctor? What are the different types of STDs there
So
are?
next topic is actually this sexually transmitted diseases.
Yeah.
A lot of people are wondering, hey, what's this dermatologist thing here talking about sexually transmitted diseases? Isn't that supposed to be like I don't know, a gynecology book or something? Well, in
Yeah.
Malaysia, most of the dermatologists, we are actually trained to we are actually trained in STDs. We actually do see STDs, sexually transmitted disease, and we can actually treat. And the thing about STD is that it's like a strong social stigma attached to it. A lot of patients do not feel comfortable coming forward to seek treatment or to seek
Yeah.
advice. Please don't
Yeah.
do that. Please know that we doctors actually maintain high level of confidentiality when you come and see us. Everything will
Yeah.
be confidential. We will try to help
Of
you
course.
in any way that you can, any way that we can, okay? And we will try to solve your problem, because remember, STDs is something that you can actually treat, and you must know what are the things that you must avoid or prevent. The common STDs we see, herpes, genital herpes, just now I showed about warts, genital warts, the syphilis
Yeah.
and gonorrhea. One thing about the syphilis is that if let's just say you know that you're at risk of getting STD, STD usually is, when you have high risk behavior, like, you have multiple sexual partners, if like, you have like unprotected sex and all that, these are actually higher risk of getting sexually transmitted disease, and syphilis is one of it. Bear in mind that syphilis, although they can show up as ulcers or this rash like I show on the palm and sole, but majority of the time patients, you do not have any symptoms, and the only way you can know is that you come and screen and check your blood for it. And why is it important for you to screen? Because syphilis is really very easily treatable, okay. If you don't treat syphilis, it's going to be bad, because down the road it can actually affect your neurological symptom. It can
Yeah.
cause, it can cause neurological symptoms. It can cause heart problems. Okay, it can even affect
Right.
your eyesight, hearing. So treatment is available. Please come forward. Put
Yeah.
away that shyness put away. You need to come and actually seek treatment, especially you know that certain things do not even show symptoms. Not enough you alone come for the treatment. You should bring your partners along if possible, because if you treat and you go back, your partner is not treated, you can still get back the same STD. So partners must be treated. They said usually it's actually a sexually transmitted diseases. So if you practice safe sexual practice, having single partner, using condom and all that, these reduce the chances of contracting STDs. All right. There's vaccination available for the human papilloma virus, HPV. Because like I said, HPV is one of the cause, the cancerous type is one of the cause for cervical cancer. Please get your vaccination if you haven't got it yet. Okay, and it also can prevent anal carcinoma, especially for transgenders who have sex men among men. All right, so please come and see. You can see us dermatologists also actually very trained in treating STDs.
Okay, let's move on to something that's a little less something but still alarming for sufferers. This is about benign skin growth. Maybe you can explain a little bit about it.
I'll just go very fast because it's actually sometimes you see this very commonly, this blackish things that looks like somebody stick something on your back, on your body. These are actually seborrheic keratosis. A lot of times you see it in middle age to elderly patients. They will come on. Okay, the main places they can see it around the neck, the chest area, and even the groin area. And this picture over the right side here, you can see these are actually small, tiny skin growth we call as skin sacs. These are all actually very benign conditions. But if you're worried, if you don't know, please come to us. Okay, we can assess and tell you whether this is actually something you need to worry or not. Okay, and treatment is actually very simple. It's easily removed. Okay, with minimal scars. So if you feel very distressed about it, the appearance of it, please come and see a dermatologist. We can actually help you.
Okay. All right. So last in our list is I'm sorry. Are you done with the explanation about skin tags? Okay.
Correct.
So we move on to
skin cancers. All right.
Of course, this must be in the list.
Yes, this must be there because I feel that I would not have played a good role in my. I would not have played a good role in my talk today if I do not educate you about looking out for skin cancers. All right, skin cancers is actually the 12th commonest cancer in Malaysia. Okay, it makes up about 2% of all cancers. And then if you can see here, when you see something like like this, where center part there's a lot of ulceration. Here you see skin is actually not very healthy. This is something you would say it is not right at all. And you need to come and see us, see whether what kind of cancer it is. Most of the time, what happens is that they would be asking, why is it that I'm getting skin cancer? I've already not go out in the sun. Remember, skin cancers, most of the time the major risk factor is actually sun exposure, and you don't have to be like in the sun like 10 hours, then only you're going to get skin cancer. Even that every 10 minutes you take to go to your office, 10 minutes you take to come back. Imagine 20 minutes a day, multiply it by 30, you multiply it by the years that you're exposed. So all this accumulative exposure to the sun, this is where that you are increasing the risk to having skin cancers. And these three that I listed here are the commonest type of skin cancers that we usually encounter. All right.
Okay.
And when you see those kind of lesions that I showed earlier, please come and seek immediate attention, immediate consultation, because we need to see whether this is actually cancerous or not. Another common thing is actually the moles. People will be like quite worried to say that, oh, is this mole cancerous? Is this mole non-cancerous? So today I'm going to teach you about ABCDE on how to actually recognize whether you need to come and seek consultation regarding your mole. A is asymmetry, where you take the mole, if say you fold your, imagine your imagination, you fold into half, they actually match each half of it, then it's all right. If it doesn't, it's not symmetrical, that is something for you to worry about. Border, B is border. If the border becomes irregular, let's just say you can draw a line here, and suddenly you see that, oh, I cannot see the border this side, that's something to worry about. C, the color is very variegated, like certain parts is darker, certain part is lighter, certain part is brown, please come and get an assessment. D is the diameter, anything more than 6 millimeters, we usually worry about. Of course, for that, It's a constellation of all the other things, your ABC as well. And E is evolution. Whenever that mole suddenly becomes bigger, suddenly you see it bleeding or you see it ulcerate, that is a definite red flag sign you need to come and
Yeah.
see us. Okay, so that is your A, B, C, D, E that you should assess for your moles, all right? And to prevent skin cancers, of course, the main cause factor that I said just now is sun.
Mm.
So please, sun avoidance, and if you need to go out, please put on your sunscreen, all right? It is, if there is one thing you need to buy for yourself, one skin product that you need to buy yourself, or you only have that time for that one skin product, it is your sunscreen. And you need SPF at least 30, all right? You take SPF
Oh.
1900, it's not going to give any more extra
Mm.
coverage. Okay, just a
Yeah.
30 is enough really to protect you from the
Yeah.
sun. And you need to put it very generously, and
Yeah.
preferably you can repeat it after about 2 hours every time, it will be better.
Mm. I see. Okay, doctor, before we wrap up our Q&A today, maybe you'd like to summarize what we went through?
Okay, all right. If I have to talk about all the skin problems, there's definitely
Mm.
more. You see, even now I'm already rushing
Yeah, of
for like
course.
10,
Yeah, you have to
10
rush through half
different
of it.
types of skin problems. So you see, it's actually a very, very common problem. Some of it
Mm.
you can actually, you can seek self-treatment, especially if they're
Yeah.
mild. You can go to qualified pharmacies, you can buy. But when they do not get better, please do come and see your doctor. You can go to your general practitioner, you can come straight and see a dermatologist. And another very important take-home point is that please avoid non-proven therapies. Not only they do not help with your
Mm.
skin problem, in fact, most of them can cause more harm. So please be very, very careful. You only have that one skin. You're going to wear it on
Yeah.
you. Okay, it is what
Mm.
you show off for yourself. Okay,
Yeah.
so keep it nice and keep it beautiful. Love and care for your skin. That is the main thing that I can say to all of you
Yeah.
all.
That's very good advice. Love
So
and
this
care for
is
your skin.
my
And also don't wait. When you see
last
any
slide.
worrying skin problem, do not wait. Go and see Dr. Latha immediately at Columbia Area Hospital, Iskandar Puteri. Okay, we just have time for one or two questions. This is something from Miss Lens Missy or Mr. If scar, how deep, doctor? Deep scar or to say open pore? Currently, I'm using simple product. Okay, this is a product without fragrance and without any smell.
Okay.
Mm.
I don't know whether Miss Lens, you're actually meaning to acne scars, or scars from any like wound and all that. So a lot of times scars is if when we say scars, it can be elevated scars. We call it like keloids, or it can be depressed scars. So you can see like a depression there. So elevated scars, keloids, those scars we have our treatment. We can do injections to actually make it flat. If it's a
Mm.
depressed scar, like you see the acne scars, a lot of times topical creams may not help so much. We can try, but a lot of times you would
Mm.
need a little bit of what it is intervention. Sometimes we do
Yeah.
some filler injections into it to elevate that depressed scar, or we can even there's also laser therapy to actually make the scar more even. Okay.
Okay. Our next question is Mr. Rajesh Paul's question. What should men apply on the skin while moving out for work? Guess when he's outdoors to keep the skin healthy and young.
Wow, okay. All right. Honestly, okay, all of us definitely want healthy, yes, keep young. Actually, whenever the skin is healthy, you feel healthy, all that, you will actually honestly look young. Okay,
Yeah.
so most important thing I would say in a skincare product is a gentle wash.
Yeah.
Okay, moisturizing the skin. All right, moisturizing the skin is very important because it will keep the skin supple. And the other
Right.
thing is sun protection, because other than causing skin, I mean, other than increasing the risk of skin
Mm.
cancer, actually this the effects of the sun is actually photo aging. If you see those who work a lot outdoors, they tend to
Yeah.
wrinkle earlier and wrinkle more. So sun protection is the other thing that you can try. You should actually make it as your daily regime, so as to say healthy, young, and handsome.
Yeah. Okay. One last question. Does sweat cause acne?
Oh no, sweat doesn't cause acne. Acne
Oh.
actually, what I said is actually multifactorial. It's actually because of the excessive sebum production from the oil glands. All right. So for some people, they might be more depending on their hormonal balance. Okay. So for that part, let's just say they have an oily skin and all that, they need to actually use the cleansers that can control the oil. All right, and we have topicals that can actually reduce the oil. And for some people, it is so bad that is when the oral vitamin A actually helps. Okay, when you control this oil production, so you can actually sort of like make sure that the pores doesn't get clogged and the pimple doesn't come up. Okay.
Okay, Dr. Latha, thank you so much for your time. And I'm afraid we have to wrap up already because it's coming to, we've come to the end of the program. And it was a very interesting program indeed because we went through the top 10 most common skin diseases. Again, if you've got any worries regarding your skin, if you see anything developing, any itch and whatnot, just go and see Dr. Latha at Columbia Asian Hospital, Iskandar Puteri. Thank you, Dr. Latha R. Selvarajah, Dermatologist. Okay, with that, we would like to wish everyone a good weekend and see you soon. Bye.